This is Tom Bernacki, and today I'm here with Jonathan Gasso from PARC Skilled Home Care, and we're going to be talking about a question: how long does Medicare pay for home services? Jonathan, you're the expert in the area. Go for it.
Yeah, so when a physician writes a script for home care services, that script is deemed it's eligible for 60 days. So a lot of times people think that they can only receive services for 60 days. But the really nice thing about what Medicare believes in is that if a patient, it's deemed necessary, that they may need more skilled services beyond 60 days, what they allow is for a recertification for another 60 days. An easy example of that is if there's someone with a wound that needs tending to. That may not heal within 60 days. And so our nurses will continue, as long as it's justified and it's documented appropriately, we technically can be on services for as long as there's a medical justification. So 60 days is the time frame, but we can always extend by 60 days.
Still have to meet medical criteria for it to be covered. So this means a doctor has to write a prescription that you actually do need home care and must certify your care. That means writing a prescription, sending it to the home care company, and you must be homebound. So a lot of the times is technically everybody could make it to the doctor's office if an ambulance picked you up and a crew of 6 people picked you up. But generally, if you can make a reasonable case that it's extremely hard, you don't have a car, you're crippled, you're in a wheelchair, these things combined with a doctor's prescription can qualify you for these things at your house. So skilled nursing care, that means wound care, changing IV lines, special care options. That's a couple times per week. Physical therapy, occupational therapy, which means like how to move around the house, how to use your upper body. Social services, that's like evaluating you or helping you with your life circumstances. A home health aid. There's also durable medical equipment, so like hospital beds, wheelchairs, walkers, certain types of braces. I know logistically this isn't the easiest thing to do at the house, but these are things that are covered. And we're talking like once, twice, or 3 times a week if you're able to get that coverage, getting a nurse out there. This is not 24-hour care, unfortunately. So some people after a stroke with dementia basically do need longer term care. This is considered custodial care that is generally not covered by Medicare. And that's kind of the difference, is knowing where that line is. And I'll talk about that later in the video. But skilled nursing care is the services in the list I mentioned, maybe a few times per week for what's called intermittent or short-term care.
And the big thing from my end, I do a lot of wound care for the home. Companies like Jonathan's PARC Home Care, realistically, a wound will not heal in 1 month. So a lot of the people at home that need wound care, on average, even if everything's going perfectly, a wound closes maybe 50% in a month. So it can sometimes take 3 to 6 months or more to heal a wound. Same thing with a broken leg, a broken foot, a motor vehicle accident. We're talking months. Would you be able to help people out like that if the doctor are recertified?
Absolutely. If there's a justified need, which it helps when the physician also sees there's a medical need for it, we will go in there and we'll carry out the prescription that the physician wants us to do, and we will service that patient, whether they need therapy or they need nursing services. We could carry it out.
Yeah, and I think just in the meantime, a doctor has to write a certificate or the script, but see you in person. So sometimes, Jonathan's company can get people out to see you guys in the Metro Detroit area, or you can make it in a clinic every once in a while to get checked on your progress and make sure it's doing good.
Right.
Great.
An alternative to intermittent care or covered medical care is what's called custodial care or private duty care. So this includes things like helping around the house, meals, homemaker services, bathing, dressing, using the bathroom, personal grooming, watching your loved one, respite care. So these are companies like Assisting Hands, which we work with closely as well. If you have dementia or stroke, or you need extra help that your family can provide, more of a private duty coverage service can be beneficial if skilled care cannot cover your needs. And this includes stuff like getting a ride to your doctor's appointment. So if you're in the Metro Detroit area, check out the website under missioncallpersonalcare.com and see what the options are. See if that's something available that could help your loved one or yourself.
And the one thing is, we talk about this in some of our other videos, but skilled home care provides things like physical therapy, occupational therapy, wound care, specialists like dietitians that can come out, nurses that can come help you. There is a difference though. If you need somebody there permanently, like 8 hours a day, 12 hours a day, or maybe 4 hours a day to help you get to your appointment and give you a ride, that's where private pay home care services can come in. And we include some links down in the show notes. Assisting Hands is a great one that we work with here. And Jonathan, thanks for answering the question. His info, if you need great skilled nursing in the Metro Detroit area, click down below. His info will be there. Thank you.
Thank you.
So if you think you qualify for Medicare coverage for skilled nursing, physical therapy, occupational therapy, speech language pathology, social services, home health care aids, once or twice a week, durable medical equipment, check with your doctor and ask them for PARC Home Care. Out of respect to our great guest, Jonathan Gasso here, his company does an excellent job. I highly recommend them in the Metro Detroit area if you work in this area or around this area. If you need more help with your foot pain, check out these links and subscribe.